The fight against cervical cancer, which kills more than 300,000 women around the world each year, has received the biggest boost in its history. The first real-world data shows that the human papillomavirus, or HPV, vaccine is cutting cases of cervical cancer by nearly 90%, raising hope that the vaccination could almost eliminate the disease in our lifetime. Cancer Research UK described the findings as historic, and said it showed the vaccine was saving lives. Cervical cancer is the fourth most common cancer in women around the world, and almost 9 in 10 deaths occur in low and middle income countries where there is little access to cervical cancer screening. The hope is that the vaccination will have an even bigger impact in those countries than wealthier nations such as the United Kingdom. More than 100 countries are now using the vaccine as part of World Health Organization plans to get close to eliminating cervical cancer. In 2018, President Uhuru Kenyatta launched the HPV vaccine in Kenya, ranking Kenya as the 16th country in Africa to introduce the vaccine into its routine immunization schedule. Dr. John Odero is a cervical cancer specialist and chief gynecologist obstetrician at Nairobi Reproductive Health Services.
Vaccine against human papillomavirus. So if you get that vaccine earlier, also we recommend it before people are exposed to sex, so around 10, 11, 12 years there. Because once somebody is exposed to sex, then the vaccine is not very effective. So then again, that can prevent the cervical cancer.
He says the next big thing Kenya and the rest of sub-Saharan Africa need to do now is to make the HPV vaccine more available and affordable.
I think the awareness and education, of course, whenever these things happen, there's always the counteracting things. Even when the COVID vaccine came, there's always the other school of thought.
Yeah.
That has been in society with us since Jesus Christ. Mm-hmm. Yeah. So the government, I think, has tried. The only thing I would talk about is making it available at affordable cost. Yeah. It's the barrier. It comes at a cost. And I'm not sure which hospital it's that free. Mm-hmm. And it's not that widely available. Mm-hmm. Yeah. So campaigns have been done, but access for me is the issue.
Okay.
Yeah.
Dr. Odero adds that screening for cervical cancer across the country should also go hand in hand with the vaccine.
Sometimes you might say it's more in Nairobi, but why? Maybe they're doing more screening. Yeah. So you need to control for those confounders. So before you make such a conclusion that maybe it's more in Nyanza, maybe it's more in Mombasa or whatever, you have to control that are they doing the same level of screening? Because the screening of cervical cancer in Nairobi is very high compared to Lodwar, for instance. Okay? So if you screen earlier and you pick it earlier, then there are treatments that can occur before it gets to full-blown cancer. So there's screening that women are recommended who are sexually active to do called pap smear screening. Mm-hmm. So if you screen somebody early, the pap smear, and then you pick it, then their treatment. By the time the cervical cancer presents, it's advanced. Mm-hmm. And that's why it is screening 1,000 times. Okay. Yes.
Looking back to the fight against cervical cancer, Dr. Odero is hopeful that the fourth most common cancer in women may one day be a thing of the past.
The trends that I've seen over the year, I can say there's been intense campaigns on creating awareness and screenings. That before screening was just in the urban center. Coming up with this local iodine screening that I talked about earlier is quite a milestone in the fight against cervical cancer. So that in a rural place that can be done. And even if you look at the kind of treatment options that are there for the early precancerous lesions of the cervix, again, a lot of progress has been made. Some of the earlier treatments were only available with very high-level gynecologists, what we will call LEAP treatment. But now, they have gone ahead and have something cryotherapy, which can be done even in my rural dispensary in Ogami, Nibo, Bondo. Okay. So again, that can treat. So there has been progress towards screening, getting more easily available screening which can be used in remote areas, and also getting things which can be used for treatment Because when you screen, you must treat.
Okay,
So cryotherapy is it's an evolution in the fight against cancer of the cervix. Treatment is something which can be availed at a very remote health facility. So I would say that we've made progress from screening, treatment, campaigns towards cervical cancer in this country.